That's why I came up with the Tushy Touch Up procedure. And so the Tushy Touch Up is just a constellation of different procedures based upon what the patient's symptoms are. So if you think about a mommy makeover, so some may need a BBL or a breast lift or an abdominoplasty or liposuction. This is really a combination of tag excision, perineoplasty, hemorrhoid removal, ligation, whatever it
We
needs
want everything to
to
look
happen.
cosmetically cute.
But there are some women, like I mean, I've had some serious conversations who, women who may be divorced, they're now starting to get on the dating scene again, and they are terrified of taking their clothes off. They are terrified from venturing into intimacy at all because they just do not want anybody to see what's going on down there. And it can be very, very distressing. So I just want to make sure that anyone's watching, anyone that you know of that may have had some of these complaints and they feel embarrassed. They've been gaslit, like, oh, that's just the, reward of bearing children. Doesn't have to be that way. And so we can have private conversations, discreet conversations, talk about what your goals and desires are and figure out a way to get it fixed. Yep.
Right. Because you, like you said, some second marriages are happening and you sustain great trauma to have that 10-pound baby vaginally that you had to have vaginally.
Mm-hmm.
And, they're disrupting that anatomy. But
Yep.
as you aged and you have less estrogen and progesterone and testosterone, things start to kind of come down and it will manifest where we tore the tissue during childbirth.
Yep. Yep.
I
And
say
then,
again because some women never get an episiotomy
yep.
and they still end up with damage from the weight of the pregnancy because that pelvic floor looks like a little hammock, a
Yep.
sling. And as you had those babies and that sling is torn or stretched out, then everything down there start to come south
Mm-hmm.
and you want to fix that and get it nice and tight and pushed up again in your second half of life.